guys well today? Morning, thanks very much for joining us. I'm joined by Amy Bromley, Deputy Secretary of the Department of Health today, who's going to talk a little bit about kids' vaccines and speak in more detail to a couple of important announcements that I'll make in just a moment. Before then, obviously a few key statistics overnight. So 861 people are in hospital. That's an increase from 818 yesterday. 117 of those are in ICU and 27 of those are on a ventilator. Both of those numbers are down one. I'm sad to have to report that 13 Victorians with COVID have passed away. And of course we send our best wishes and our sincere condolences to their families. This will be a very difficult time for them. In terms of test results, we had some 59,670 PCR results come to us overnight. That meant there was a further 19,491 positives from PCR tests and 18,503 people who had reported their positive, registered and reported their positive rapid antigen test. I thank both those who are in queues and have queued up to go and get a PCR test, and all the staff who are making that happen. I thank them very much, and also to those who have undertaken a rapid antigen test at home and have then, if positive, have gone and registered. That is a much better system, and it means people are getting their results as fast as possible. Now, I know there's some pressure in that testing system. It's not just in Melbourne or in Victoria, it's across our whole country. Everybody wants the same thing at the same time, and we have many, many cases in our communities right across our nation. So that means more people with symptoms, more people with a reason to test, more people going and getting tested, and that does put some pressure on our systems. I thank all the staff who are really doing their very, very best, and of course I thank all those people who are being patient, waiting for their important results. In terms of vaccination performance, we'll have a bit more to say later this week about third doses, or what are sometimes called boosters. I think we really have to see it as a third dose rather than a booster shot. It's only when you have 3 doses that you've got the maximum protection, not just against severe illness, but against getting this virus and giving it to somebody else. That is, and I'll come back to that issue in just a moment in terms of what we're seeing in our hospitals. But we are at 93% over 12 years of age double dosed. We have about 17.6% of Victorians 18 and over have had 3 doses, so we want to see those numbers continue to grow. My last update is that about half of those who are eligible for a third dose or a booster have had that third dose. We've got to do better than that in coming weeks. Now, I know it's been a period, perhaps getting your third dose is the last thing on people's minds as they celebrate and spend quality time with family and friends. But now, as we are getting into January, we need to focus on getting everyone who's eligible to be boosted or to get a third dose to go along, make an appointment, honour that appointment and get the additional protection, not just for yourself, but for all of us, and particularly for our health system, that comes with a third dose, particularly against this Omicron variant. I know this is a lot of numbers, but I'll just run through quickly a handful more. In terms of kids' vaccinations, we've had some 39,000 bookings that are made currently since the system opened. 3,000 kids received their vaccine yesterday, and there are 43,000 spots that are currently open and available. So we'd encourage parents to get online, make one of those appointments for your kids, and then honour that appointment. We do know that this is challenging. It's yet another thing to have to do. It's another thing that we're asking you to do. We've got a couple of announcements to make today, and I'll speak to them very briefly, and then I'll ask Naomi to go through a little bit more detail. But you would all remember that last year we recruited and worked very closely, over and above what we'd signed up to do, but we worked very closely with our community pharmacists who've done and are doing an amazing job, our GPs who similarly have and continue to do an amazing job. But it's a very different business model. They're not designed and they're not in business to run large vax hubs. So a grants program, we did this last year, we're doing it again this year, and I'm pleased today to be able to announce another $4 million of grants to GPs and community pharmacists to go into schools after hours, so a familiar environment, a well-known environment, to get our kids vaccinated. That begins very soon. Naomi can speak to the details of that. So that's just a continuation, a trusted, local, well-known environment using trusted and local, well-known, well-respected healthcare professionals, GPs and community pharmacists. They won't do that without support. It just won't happen. It wouldn't be efficient. They would lose money if they were to do that. So these grants help to take that care even more locally than would otherwise be the case. Beyond grants, we're also announcing today some 30 pop-up clinics that will pop up, as the name indicates, in schools, starting very soon. You've got a list, I think, of local government areas where those pop-ups are going to happen. We'll continue to refine and add to that list. We already have a number of state vax hubs, as you well know, right across the state. This is about additional time-limited activity in a trusted, well-known environment, taking the vaccination program to the local community that it will benefit most. And I thank Naomi and her team for the amazing job they did all through last year, making us one of the most vaccinated communities anywhere in the world. And of course the work they're doing around third doses and the work they're doing around kids vax. We'll have more to say about third doses and the number of appointments that are available and what we want people to do later on this week. But please, if you are eligible and you've received your letter from the Commonwealth Government telling you that you're eligible, noting that that eligibility has changed, will be very soon down to a three-month interval. Please make an appointment. Please honour that appointment. At the moment, 2 doses are protecting the vast majority of people from serious illness, but it's only with 3 doses that you'll be prevented not just from serious illness, but from getting this virus, this Omicron variant, and therefore giving it to others. Plus, of course, we don't know what's coming at us later in the year. That's the nature of variants of concern. There have been more than one, and there'll probably be more into the future. So, having the maximum protection is so important. Just finally, there is significant pressure in our health system. We know that. We absolutely appreciate that. And we again send our thanks and our best wishes to all of our staff who are doing such an amazing job. I do want to point out, though, that yesterday there were 3,992 hospital staff that were not available to work because they were either COVID-19 cases or close contacts of cases. There were a further 422 Ambulance Victoria staff who were unavailable to work as well. So that's at least 4,500. They are self-reporting numbers. I expect that number is in fact higher, and that does put great pressure on our system. It's not a matter of money or a matter of machines. They don't treat people anyway. It's qualified staff. It's people who provide healthcare to other people. And our staff, because we've got so many cases in the Victorian community, this is so widely infectious, like any group within the community, there's a significant number of people who are getting this or have already got it, and are the others who are isolating because they live in households with those healthcare workers. The other point to make is that 50% plus of our cases are 18 to 39-year-olds. That covers such a large part, not exclusively, but it does cover a large part of our health workforce. So it just stands to reason that that's where the pressure starts, that's where it comes from, and that's the real challenge that we face. So can I, on behalf of all Victorians, please pass on my profound thanks to 2 groups of people. One, everybody who is working in our health system. Thank you so much for your passion and your commitment, your skill, and the amazing work that you do. And secondly, can I thank, well, it's about 171,000 active cases. I think it's fair to say there's at least 200,000, maybe many more, Victorians who are isolating at home because they're a case or they're a close contact. I want to thank them for the sacrifice they're making, the contribution they're making to keeping our state safe. Now, of course, Minister Foley yesterday announced some furloughing changes. All of those will start to take effect, and that's very important for health, for critical infrastructure, for important critical supply chains like groceries and food. All of those issues we'll update you as we go forward, and we'll update you as well about boosters later on this week, third doses later on this week. Just finally, the last number from me, we gave out, I think, something like 34,000 rapid antigen tests yesterday at state testing sites, 56 of those testing sites. That'll be for people who are close contacts who need to test but don't necessarily need a PCR test, turning up, being given a free rapid antigen test. I'd encourage people to do that. They're available at those state testing sites. and we'll have further updates for you later soon, as soon as we can, in relation to the orders that we placed some time ago, stocks on hand, and how we see things unfolding in relation to rapid antigen testing coming weeks and months. That's pretty much all I had by way of update, and a couple of important announcements. Again, thanks to all those who are working in the system, but most of all, thank you to those who are getting their kids through the first dose. Thank you to all of those who've made a third dose appointment, a booster appointment, and honoured it. And please, can you just take the time, if you're eligible, if you've got that letter, please go and make an appointment, whether it's at a state clinic, a community pharmacy, or your local GP surgery, to get your third dose. That's how we will limit the spread of this. Just finally, we have some people obviously that are gravely ill, some people that are in intensive care, but the vast majority of people are in hospital and not requiring that sort of care. If we were to stop isolating people, if we were to stop testing, if we were to let this rip, as some would have us do, then we would finish up not with hundreds of people on general wards, we would finish up with thousands, and we all know what that means. It means every non-COVID case that requires hospitalisation will not be able to get that care. So I know it's deeply inconvenient, I know it's frustrating to be double dose vaccinated, even triple dose vaccinated, and having to isolate at home because you've got this. I thank you very much for the contribution you're making. You're playing such a big part in keeping us safe and making sure that our health system, whilst under enormous pressure, can still cope to provide those who need the most urgent care with the care they need as fast as possible. I'll now ask Naomi to speak to those two announcements, and then we're happy to take a few questions. Thanks very much, Naomi.
Thanks very much, Premier. So, as the Premier said, throughout 2021 we worked very closely with GPs and pharmacists to support the Commonwealth's vaccination program, and it's by supporting these local trusted figures that we know that we did achieve fantastic vaccination rates through the course of last year, and that we will go on to achieve fantastic vaccination rates through the course of this year. Can I thank all of the GPs and pharmacists who applied for our vaccine enhancement grants? And we had Dr. Aluthka with us over the weekend to talk about how he was using that grant in his local community. These grants have really helped primary care to expand their operations on site, in their pharmacies, in their clinics, and in supermarkets and other local locations as well. So the expressions of interest for that grant closed last night. So far we've approved $3.45 million in grant funding for 271 primary care providers, and there are some more applications that came in late, and we're assessing those today. So 22 priority LGAs that were identified in terms of the access to primary care points, and also what we saw in terms of patterns of primary care administration in those LGAs were identified and have been targeted, and 51 of those grant recipients are in regional Victoria. These grants do make a real difference. We saw that last year. Just some of the examples of the grants that we've seen go out in the past week have been around a GP in the inner city who now will be able to administer 200% more doses than he was able to administer, and a pharmacy in the city of Knox who can now open their doors to walk-ups, and also to extend their opening hours by an extra 10 hours a week. So these things make a material difference. We've also been able to provide some additional doses in recent days to some of our grant recipients of the 5 to 11-year-old doses, and we know that that'll make a real difference in getting those doses into Victorian kids' arms as quickly as possible. The Premier mentioned the Victorian Schools Grants program, which is now opening, and this will enable these same primary care providers who choose to apply to deliver vaccinations to students in the school environment outside of school hours, obviously once school returns. So we can sort of think of them as mini vaccination clinics at both government and non-government schools that do need a little bit of help, a little bit more uptake once school returns. And these are on top of the 30 pop-up sites that the Premier mentioned. And we'll have more to say about those 30 pop-ups in coming weeks. The Department of Education and Training will work with the grant applicants to match them to a school, and the successful applicants can receive $6,500 plus an additional $5,000 for a clinic establishment fee per school. Plus there's some additional loadings for specialist schools and small regional or rural schools that might have quite a few students. All that money will go towards staffing, travel, equipment, and those kind of costs that you can imagine will be incurred by the primary care providers in providing this service. There's nothing more important than Victorians can do right now than make a plan to get their booster and make a plan to get their children vaccinated. Not every Victorian child is going to be vaccinated this week or even next week, but we are confident that over the course of January, Victorian children will have an opportunity to be vaccinated. I know that there is some frustration out there because there is a lot of pent-up demand. I would really encourage parents and carers to keep trying, keep looking for appointments. We'll continue to communicate where there are appointments opening up in the state system so we can get that information out to you about where those opportunities are. Don't wait for school, don't wait for February, make a plan and get it done as soon as possible. Finally, I would like to really thank the staff in our vaccination sites who opened up to the 5 to 11s yesterday. We had some lovely feedback from on the ground, some really fantastic experiences. Our sites are looking beautiful with the Enchanted Forest theme, and the staff really went above and beyond to make sure that that was a fantastic experience, and will continue to do so over coming weeks. Thanks very much.
Happy to take any questions you have.
Premier, welcome back. You feel relaxed?
It's always good to be able to spend some time with family and to be focused and be ready for what will be a very challenging year, just as last year was and the year before that. There are no easy days in this job, no easy days as we deal with a global pandemic. I want to thank both Deputy Premier Molino and also Minister Allen for their acting premierships, and we're all raring to go. Not just to make sure we keep our community safe, but to continue rebuilding, repair, continuing to invest in the things that Victorians voted for, the things that Victorians make it very clear to us every day they need: hospitals, schools, road, rail, jobs, skills, all of those things. They've always dominated me and us, and that's what 2022 will be all about.
Premier, should no back job be allowed to play in Australia? What's been your reaction to the saga?
Well, that's entirely a matter for the federal government.
You said back last year that all the people who are watching the tennis at the Australian Open, they're going to be double vaxxed. All the people that work there are going to be double vaxxed.
Yes.
It stands to reason that if you want to get into the country to be part of that tournament, then you should be double vaxxed as well. Do you stand by that?
Yes. The issue of who gets into the country and their vaccination status, though, is not a matter for state governments. I don't issue visas. The Commonwealth Government does that. This is a very active process. As you know, there was a court ruling last evening. Whether that's appealed is a matter for the Commonwealth Government. Whether the Immigration Minister uses his quite extraordinary powers, that's a matter for him. I really don't want to offer any further comment to that because I don't think you could get a more active process. But of course I stand by my comments, and our record reflects. But we have not sought to, in fact quite the opposite, we've not sought to convince the Commonwealth Government to allow anyone in, quite the opposite.
Well, you did say in November, you said, I don't think it's too much to say that if you want one of those visas and you want to come here, then you need to be double vaxxed. Do you stand by that, or do you now think that you shouldn't have been commenting on whether or not someone should get a visa?
No, I was asked a direct question, and look, I don't want to be playing word games, and I'm not, but when we talked about exemptions previously, you would recall that Minister Hawke had said that it was his expectation that if you weren't double vaxxed, you wouldn't get into the country, whether you're playing tennis or doing anything else. Turned out that wasn't the Commonwealth Government's position, and that they have been letting people in who haven't been double vaxxed. It usually requires a state government to, in effect, sponsor that person or support the exemption from being double dose vaccinated. So the notion of exemption was a little different then, and the position was a little different then, because there was the prospect that people would not be allowed in at all unless they were double vaxxed. I stand by our comments. I was asked the question, would we be asking the Commonwealth Government to exempt certain people from the requirement to be vaccinated? No. That was the answer then. That's the answer now.
When it's an application of the rules at a Commonwealth level, are you upset as a Victorian Premier, when the Australian Open is, you know, such an international event that Victoria takes such pride in,
Yes.
the implications that that has had for Victoria's reputation?
No, I think that this tournament is much bigger than any one person. It is much bigger than any one person. And, you know, I think that Rafa and a few others have made the position very, very clear. This tournament is much bigger than any one person. It's a Grand Slam. It's the biggest thing in tennis in the first quarter of the year, every year. It's a massive event for us, and it's bigger than any one person, whether that be, you know, in the court or on the court. This tournament's much bigger than any one person.
Was the vaccination exemption for Novak granted by a Victorian panel, an independent panel, or was that panel aligned with the Victorian government?
No, I think you'll find Tennis Australia had a process. I'd leave you to speak to them if you want any further details of that. I am very conscious of the fact that it's one thing to ask me to speak to comments I made some months ago, and we've been completely consistent with those comments because they were our view then and they're our view now. But let's not get into the ins and outs of exactly what's occurred here by way of process. That matter's just been adjudicated. It could be appealed. Who knows? The Immigration Minister may have further decisions to make. I don't want to interfere with that. And look, at the end of the day, whilst we might have views on whether we would play a role in the granting of a visa, and that's what those questions basically relate to, we don't grant them. And our view's been sought, and we've been very clear about our view.
The Immigration Minister still has the power to cancel his visa.
Yes.
Calling on him to enact that power, would you like to
No, the nature of quite extraordinary powers that are held by the Immigration Minister is that I'm not going to be out there every day calling for him to use them or not use them. That's a matter for him. And he ought to do that free of any pressure, free of any public debate and discourse, because otherwise you find yourself, I'm not a lawyer, but you might well find yourself back in the federal court again. Again, these are not matters for me. We have many things to do, many things to get on with. Issuing visas is not one of the responsibilities that I have. Others have those responsibilities, and I direct you to them. If you want to know what Alex Hawke's going to do, then get on the blower to him and have a chat.
Can prior infection allow you to participate in the vaccinated economy?
There are some rules in terms of, for instance, if you, when you go to get, just as I did, when you go to get your first dose or your second dose, you're asked whether you have had COVID. And the reason you're asked is because you won't necessarily need the second shot if you have had COVID and you've had it recently. Let me get you the exact words as it relates to different sectors within the vaccinated economy. But those rules, and as they apply to getting into the country versus participating in the vaccinated economy, they're slightly different, because there is, and I'm going again getting into splitting of hairs, but whether you need a vaccine or whether you can have a vaccine or whether you need to have a vaccine are two different things. There are some people in our community who simply cannot have the first, second or third dose. They are given a green tick for the purposes of the vaccinated economy, and they are considered vaccinated even though they've not had a vaccine. That's a different group of people than those who choose not to get vaccinated. Now, even having been infected recently doesn't necessarily prevent you from having a dose. You may not need it, but it's not a matter of you not being able to get vaccinated, if you understand the difference, I'm sure you do, between those two things. Again, let's not, all those matters will be matters for the federal government to have a think about, as they already have. And again, as I've said a few times today, I don't issue visas, they do. Let's wait and see what they do about this.
Will you look at extending commercial tenancy relief schemes to some businesses struggling at the moment with isolated staff?
Yeah, look, the most important thing is that we support every Victorian who's in ISO and everyone who's affected by that. I'm not here today to make any announcements in relation to tenancy or economic support. Today's about making sure that we take the vaccination program to schools, whether it be using GPs and community pharmacists or taking our pop-up clinics and putting them in schools. That's what today's all about, but we'll be out again tomorrow and the day after, and there'll be other opportunities for us to announce further support, but I'm not making those announcements today. I would just say, though, that the furloughing changes that the Minister has made yesterday, no doubt There will be further discussion at National Cabinet on Thursday about these issues and about trying to get as many critical workers, so whether it's in emergency services, critical supply chains, health and hospital system, all the way through, trying to get as many people back to work as quickly as possible off the back of a rat test rather than having to isolate, the assumption being if you've got a rat test you're clear. And all the advice to me is that's as predictive of a positive as anything, 95% or so. That's critical. Now, I think we'll probably add to the list of different groups. I won't speculate today on what those different groups will be. I had a conversation with Dominic yesterday. National Cabinet, I'm sure, will deal with these matters on Thursday, but Martin Foley made some announcements yesterday. We certainly don't rule out adding to that. Just be a matter of getting advice.
Who do you see as high priority in adding to that group of industries?
Well, let's wait and see. Again, I'm not here to tell industry what their priorities are. We're deeply engaged with the hospitality industry, with freight, transport, logistics, supermarkets, food distribution, right across the Victorian economy, critical infrastructure, manufacturing, all of those. Every sector is important to the people who work in it and the people who rely upon that pay packet every single week, every single fortnight. It's not my practice to tell business what's most important to them, but instead to listen. And I'm sure that I know that many of my colleagues have been speaking with the industry, and I'll be speaking with a number of industry leaders throughout this week also, just to get a sense of what their priorities are.
You mentioned your chat with Dominic Charité. What was the upshot of that, and is there anything that the two of you have agreed upon that you'll take to National Cabinet?
Look, it's always, I speak, text. We've not Zoomed before, but I'm in pretty regular contact with the Premier of New South Wales, and that makes sense for Victorians. The more consistent we can have the rules between the two biggest states in our nation, the two real, powerhouse states of our nation, that obviously is of benefit to Victorians. It is interesting though, we've gone from a situation where we had the lion's share of cases, where we kind of had a different pandemic, both New South Wales and Victoria, than the rest of the country. The way this Omicron variant's spreading now, pound for pound, you've got cases in, arguably more cases in many other parts of our country. But so regular contact's important. I think we're very close when it comes to schools and wanting to have kids have the least impact on our kids as we could possibly have. And I look forward to making some announcements, not necessarily a joint announcement, but I think you'll see there'll be some consistency between New South Wales and Victorian school policy, and we'll have more to say about that soon.
Could I just ask about hospitals?
Yes?
Are you aware of reports that healthcare workers have been pressured into going to work despite testing positive to COVID?
There are some circumstances where it'll be perfectly safe, depending on where they're working, the sort of work they're doing, and of course their general health. If they've had a mild case, again, if you want to put some specifics to me offline, I'm more than happy to follow that up. But we're engaged with all of our staff, whether they be close contacts or people who've had the virus and are at a stage when they can come back to work. We treat them with respect. We value and honour the work that they do, but they're in very high demand, and we're speaking to lots of different people, and that's why those furloughing decisions yesterday are so important, to get people back off a rat test each day for just a 5-day period. Then they're free and clear beyond that. But we think there are a lot of people out there who will be able to return to work, and there's no more important workplace at the moment than on the ward or working a shift for Ambulance Victoria. We're trying to substitute a number of staff from different parts of the system. Again, I just stress for the benefit of those who are watching, this is not about money, this is not about machines, it's not about PPE and equipment, it's about people. And we've got 170,000+ cases active across Victoria. A good number of them are going to be, are younger people, and a good number of younger people work in arguably one of our biggest industries, and that's the health and hospitals sector. So we do have a lot of cases, but it will be safe for some of those people, despite the fact that they've had the virus or been close contacts of people who've had the virus. It will be safe for them to return. They're the sort of discussions that we're having.
The Health Minister said last week that we should restrict our movement and stick within our own social circles without actually going into lockdown. Would you be advising people to adopt a lockdown type behaviour?
No, I think it's just common sense. I think people are already, if you look at it, people are already changing their behaviour. They're kind of moderating and changing their plans a bit. I would just say I don't want anyone to do things that would put more pressure on the health system, and I don't want people to do things that would make them sick. but we have a small, I'm not diminishing it or downplaying it, but it is a relatively small number of people who are gravely ill, and of course we're working as hard as we can to support them, and we wish them well. But there is a much larger group of people who need hospitalisation for a range of different reasons. One, it's mild, this disease, when you're double dosed, but it can still be significant, particularly if you have underlying health issues. And we know there are many people in the Victorian community who, through no fault of their own, do have underlying health issues. And that can be as simple as asthma. So we do have a lot of people in hospital, not in intensive care, but in hospital more broadly, and those numbers will only grow to unsustainable levels if we weren't isolating at home, if we weren't going through all the difficulty, all the burden, all the inconvenience of trying to limit the spread of this. People are changing their behaviour, people are using common sense. People don't want to get this, and they don't want to contribute to spreading it. But again, I'd be grateful to all of you, any seconds that you can devote in your coverage, in your bulletins, in your work, to encouraging people to go and get a third dose, to go and get the booster. That's what will prevent this spreading quite as fast as it is now. It won't stop it, but it will drive it down. And that's really important for individuals, for families, and of course for the health system more broadly, for COVID and non-COVID patients.
Just on those pressures for the health system that you were talking about before, what more can be done to stop those code reds? We've had 2 in the past week. What more can be done? Talk a bit about substitution. What else?
Yeah, every health service is different. Every shift is different as well. So there'll be different pressures, and this virus will manifest in lots of different ways. And if you're at the Alfred, or you're at the Royal Children's, or you're at the Royal Melbourne, we talk about state trauma centres that deal with our big major car accidents, industrial accidents, those sorts of things. Their pressures and their juggling act, their balancing act is much different than if you're at even a large regional hospital who has that workload and so much more. Every hospital is different. Every team is working as hard as they can to balance out what are extraordinary challenges at the moment, and it's presenting differently. We don't need hundreds and hundreds and hundreds of ICU beds, but general ward beds, that's where we've got nearly 1,000 patients now, and who knows what that number will go to over time. But you're having to do more at a time when you've got less staff that you can call on. So that becomes really, really challenging. So it's working with unions, working with our staff, working management, being as creative as they possibly can, and that guiding principle. And as a parent, as a husband, as a son, and as a patient last year, let me tell you, there's one principle that guides our public hospital system, and it's the most important principle. The sickest patients get treated quickest. That's what we always want to safeguard, and that will mean that some people will have to wait. But if you happen to be one of those sickest who needs to be treated quickest, that's the way you want the system structured, every hour of every single day. So it's a difficult balancing act, but our teams are working as hard as they can. They're doing their very best. I thank them so much. And it's hard to answer that question because it's different in every single shift. The challenges will be different. I was talking to a good friend of mine who is normally a midwife teacher, so she's a midwife educator. She's been back on the tools, as she put it, doing some shifts in recent times. And we're seeing a lot of that. People who they're clinically trained, they wouldn't normally be doing clinical work, they'd be playing another important role in our health system. I'm deeply grateful to her and thousands like her who are going above and beyond. And we're going to need more of that over coming weeks.
Are the sickest people unvaccinated? Are the sickest people
Pardon?
We're only treating the sickest people first. In this pandemic, yes. Are the sickest people those people that haven't got vaccinated?
Well, that's certainly... I'd need to come back to you in terms of what the most recent data is showing us. Certainly last year, the vast majority of people who were in hospital, whether they were critically ill or not, were people who had not been vaccinated. But that was when we were dealing with Delta, where to be unvaccinated meant you were at much greater risk of getting it. Omicron is different because even if you are 2-dose vaccinated, the vaccines are protecting you against being very, very unwell, but they're not protecting you against actually getting the virus or giving it. So it's slightly different. I'm happy to try and have someone who's clinically trained come back to you with an answer on that. But I would just say, get vaccinated. Nothing's more important to avoid being gravely, gravely unwell, putting pressure on the health system, causing pain and suffering, not just for yourself, but for the people who love you, go and get vaccinated. There are still first dose appointments, still second dose appointments. There are heaps of third dose appointments, and there are kids vaccination appointments as well. Nothing's more important today, just as it was all through last year. Go and get the protection of a free, safe and effective COVID-19 vaccine.
Do you have any information on how prevalent the Omicron strain is in Victoria as opposed to Delta, specifically in the hospital and ICU?
Let me come back to you around that. It might be something that one of our acting Cho or Cho might be able to speak to later on this week. If that's of interest to you, I'm more than happy to put that request in.
So we've had 2 code reds in the ambulance systems last week.
Yes.
Is it time to review procedures and ways that we can...
I can assure you, I'll be speaking with Ambulance Victoria this week just to have a chat to them about things. They're all working as hard as they can. I know many paramedics. I've had the great honour of working closely with them for a long time. Every hour of every shift, they're out there doing their level best. I would just say, you don't need to be an expert on the health system. Just think about this for a moment. If every time you attend a patient, you've got to put PPE on, then take PPE off, go through all the infection control, prevention and control protocols at every point of care, that adds seconds, minutes, and ambulance services it's all about minutes. It's all about precious time. We're putting extra crews on, they're working in different ways, they're being as innovative as they possibly can be, and they're highly skilled, highly competent people, great people, hard-working people who always look to do more and do better. But we've got 420 of them who are at home, who aren't out on the road because they've got this or they're a close contact of someone who's got it, and who knows, that number may well be higher. So it's about 4,000 hospital staff and about 400 ambos. That's a self-reporting thing. I think there'll be more. There'll be other people who haven't yet told us that they're not available. It could be upwards of 5,000, maybe even more. That's a lot of people. That's a lot of staff. Plus, of course, there's a lot of people who are very tired from 2 hellish years. So they're having a break, and who would argue with the need for that when you've worked as hard as they have? But look, there's pressure there. We're all doing our best. None more so than our hospital teams and our ambulance teams. I thank them. I ask Victorians to do everything you can to try and take some of that pressure off our hospital staff. So wearing your mask where the rules ask you to, isolating when you've got symptoms, getting tested if you've got symptoms, isolating and or getting tested if you're a close contact, using common sense, getting your second dose if you haven't had it, your first if you haven't had it, and making an appointment for your third, and getting your children vaccinated. All of those things are critically important for you, for the people you love, and for the people that we all rely on, our nurses and doctors and ambos. I can't think of it. Do you need any more reason? Seriously? Do you need any more reason than that to go and play your part? 93% of people have. I want to see every one of those 93%, if not more, getting their third dose as well. Yes? That is our aim. That's what we're working towards. It might look a bit different. There might be some testing involved. There might be all sorts of different things that we have to do to keep our students and our staff safe and to keep each class in attendance and keep the schools open. But that is our aim. We will do everything we can to avoid home schooling, but we'll have more to say about all of those details soon. I'm not being critical of other states who've made decisions to put back the start of their school year, but we want to be there as close to normal as possible, day one, term one. But the Education Minister and I will be out to talk to you in good time about what those arrangements are, and I want to try and have those arrangements as close to New South Wales as we can. That's very important for border communities. It's also, I think, just as I said before, it's always in the interests of our nation if you've got the 2 biggest states with essentially the same rules. I think that works well. We're not quite conceding or ceding the options we have to go a different way if we have to on any given measure, but that consistency is worth something, at least in my judgment.
Do you know how many Omicron patients are in ICU at the moment, and have there been any deaths related to the Omicron variant?
No, I don't have those details, but I'm happy to try and hunt them down for you and provide you with some of those details. Some of this is about doing as much as much genomic sequencing as we can, because you can never be certain until you've done some of that testing. And I suppose we're probably not wanting to put in any additional pressure on our labs if we can. But let me come back to you. We may have some data to give you there.
Are you collecting that data? Are you doing sequences for people?
Not on everyone. Not on every case. Certainly, I'm not around hospitalisations. We'll be doing more. I'm not sure whether we're doing everybody. Let me find out for you.
Sorry, Naomi, can you describe you for one?
No more for me. I wasn't. I'm fine with that. If there's no more, it's all good. But yep.
We've had a few restriction changes over the
Yes,
last
we have.
Are there any restrictions that you're willing to rule out as we balance further waves, lockdowns, lockdowns?
Well, the only one talking about lockdowns is you at this press conference. I'm not. Seriously. We've asked Victorians to do what was incredibly important, and that was to get a first and a second dose. We've now got this variant. The first and second dose still protects us against serious illness in the vast majority of cases. That's great news. But from a transmission point of view, from an infection point of view, the vaccines don't work anywhere near as well against this new Omicron variant. I don't know what variant's coming in a month or in 6 months. I don't know. So I can never give you an absolute answer to these things, but we're going to do everything we possibly can to have as few rules as possible. That's what living with this or normalising this or pushing beyond it is all about. Victorians have given a lot, and I want that to count for something. It currently does. We're having to live a bit differently, but we've got very few rules compared to, go and have a look at Europe at the moment. It's very, very difficult. We have achieved a lot. We've just got to lock that in, and nothing safeguards what we've built more, as well as safeguarding you and the people you love and the people we all depend upon, our nurses, doctors and ambos, than getting a third dose or getting your kids vaccinated. There are appointments available. Please go and make one, then honour it, and you will have played your part for every good reason in our fight against this.
Sorry, just one more for you. On that issue of healthcare workers being asked to return to work when they
Yes.
have COVID, are they being asked to return during their infectious period?
What I'm indicating is I'll come back to you if you've got some specifics. No one's being asked to do anything that isn't safe for them and for the patients they'd be caring for. Obviously, your virus status becomes relevant based on the work you're doing. If you're working on a cancer ward with a whole lot of immunocompromised people, then probably not. If you're working on a COVID ward where you're providing care for lots of other COVID positive people, then that might be a different thing. And again, it does get back to the issue of every hospital is different, every campus of every health service is different. They all do different things. It is a devolved system. Not every hospital offers every service that the hospital in the next suburb or town offers. So let me try and get you the best answer I can, but I'll have to come back to you on that.
And just on the pop-up clinics, will you need to expand who can administer the vaccine to staff those extra clinics?
No, I think we've got a pretty broad range of people who are skilled and qualified to do that. If we had to do more, if we had to, as you say, broaden out the number of people, the types of people who are qualified to do that work, we would. We have had a lot of nurses doing that work. We have less of them now because we're trying to send them back to the ward where they're needed more. But everyone can be confident that the people who are administering vaccines, no matter whether it's a third dose or a paediatric dose or first or a second dose, they are highly skilled, highly trained, and in our state clinics, we've had very, very few incidents, despite the fact that we've literally immunised half our state. Naomi has been waiting for a series of questions. Naomi.
Sorry, Naomi, just a question for a colleague. What's your advice to parents on how to manage children who are either suspected to have COVID or COVID, especially if they start to pick up?
Yeah, absolutely. So for parents who suspect their kids might have COVID, doing a rapid antigen test is probably the first thing you need to do. If that's a positive result, of course, then you need to report that through the new online system. And then that child will need to isolate for 7 days and their household will need to isolate for 7 days. Now, at the moment, it can be tricky to get a rapid antigen test. I think around 34,000 were given out through our PCR sites yesterday. That's fantastic. the Premier said there'll be more to say about the supply and the distribution of those over coming days. If you can't get a rapid antigen test, you can still get a PCR test. I think there were 60,000 PCR tests reported yesterday. And of course, if that is positive, same rules apply: isolation for 7 days for the child and also for the household. And of course, as parents and as a parent myself, monitoring your child's symptoms and their general health and wellbeing really closely is important. Talking to your GP, letting them know what's happening and raising any concerns that you might have would also be appropriate steps to take. There's the checklist on the website as well for people who are COVID positive. I think that's really clear and useful to guide people through the different steps and options that they have available to them.
And what are you seeing in children who have most severe symptoms and like
Well, probably a question better directed to one of our Chief Health Officers when they're here. But by and large, children continue to present, with relatively mild symptoms, and thankfully many of them are not unwell and don't need to go to hospital. But of course, some of them do have more severe symptoms, whether they're respiratory or other concerns that come up in the course of their COVID journey. And obviously, we're well equipped here in Victoria with our paediatric services to cater to those young people.
Just one question. I mean, a lot of parents are saying, you touched on it, but a lot of parents are saying they just can't book in. Like it's February before they can get in, so they're freaking out. What's your message to them?
Yeah, look, it is, I know that there are some parents who are having some challenges and my team go on and have a look on the Clinic Finder all the time in different areas to see how the availability is going for primary care, and obviously we monitor and try and make available as many appointments through the state system as we can. I think today there are around 40,000 appointments available in the state system across the course of January. They might be a little bit bumpy in terms of where they're available, but we're continuing to open up more as soon as we can. And of course, actually having the system up and running and getting staff credentialed, understanding how the flow works with paediatrics, all of the things that we're learning yesterday and today will help us make this system more efficient. So what I would say to parents, and what I say to my friends and family when they ask me this exact question, keep looking, keep jumping on, keep checking in your local area for a primary care appointment or a state system appointment. There will be more opening up over coming weeks. I was in contact with my Commonwealth colleagues yesterday, and they assure me that there are 220,000 paediatric doses in Victoria right now, and there are obviously more coming every single week. So there's plenty of supply here. We know that demand is really, really strong at the moment. We do need to make sure that our system capacity, both in primary care and the state system, can get those doses into those arms. Of course, with the workforce challenges that the Premier's spoken to, that's a challenge for the vaccination system as well that we need to work through. But I am confident that over coming weeks and over the course of January, the vast majority of Victorian kids will have an opportunity to get vaccinated, and they absolutely should do so.
Thanks very much, everyone.
Thank you.